gastric bypass surgery has been the gold standard for weight loss interventions now for at least 20 or 30 years. It is also perhaps the gold standard with respect to curing and resolving type 2 diabetes, which is of grave concern and something that afflicts at least 10, if not 15% of Americans today. Gastric bypass surgery is a minimally invasive operation. It is a laparoscopic procedure, meaning that it's done usually in about an hour's time with 5 small laparoscopy incisions. Generally speaking, I keep patients in the hospital overnight after their gastric bypass operation and make sure that they're drinking liquids successfully before being discharged from the hospital. I spend some time crafting a special diet plan for people undergoing gastric bypass surgery to be successful both before the procedure, during that recovery phase, and then over the long term. And this is outlined in the books and materials that I've written for this purpose. The real benefits, the real pros of gastric bypass, if you will, are that it has been around for a very long time. We as surgeons in the weight loss surgery community have improved the procedure over the years in subtle ways that have made it better and more successful and have less problems associated with it. For one thing, most North American surgeons have made the procedure so that it has less tension now on that important connection of the stomach and the jejunum. And so for that reason we see very few leaks and problems at that connection zone. That's much better than was the case 20 years ago when the surgeons felt that it was better to make that pouch very small and the connection was made very high up on the stomach where the tension was greater. So these types of improvements have led to better and better outcomes and lower risks over the years, such that it remains what is probably considered the gold standard in the eyes of most North American surgeons. Further advantages are that the gastric bypass tends to produce very rapid weight loss. If a person is motivated and works hard at the diet that is prescribed, they will generally lose a lot of weight in those early weeks and months, and by a year or 18 months have usually hit their goal or hit a very good place where they're at a very healthy weight, and then they just need to work to keep it at that weight. There are disadvantages of the gastric bypass also, and those are that it does involve some reduced absorption. There is reduced absorption of calories and nutrients, which is a good thing for the weight loss, but it also leads to reduced absorption of some important vitamins and minerals. So there are some important supplements to be taken, and chief among these are vitamin B12, vitamin D, and just a general multivitamin that does have iron in it. Those supplements generally will help people avoid any of those nutrient deficiencies, although they do need to be tested at regular intervals along the way in the future, because sometimes people can still become deficient, for example with vitamin D that a lot of people are low in. So long-term management of gastric bypass does require some ongoing supervision, some lab testing, and some contact with a physician who understands what has taken place. Other potential advantages are that there is a potential for ulcers or gastritis in that stomach pouch. That's why it's very important to avoid alcohol abuse, tobacco, and the non-steroidal anti-inflammatory drugs. That's the Motrin, ibuprofen, Aleve, and naproxen class of medications, because these are very hard on our stomach and they do cause gastritis and ulcers. Lastly, I would say that the intestinal part of the procedure in a rare case can result in some scar tissue or blockage phenomenon of the intestine that can require more surgery. So a few people do experience this over the years, and it's important to understand that if you are having symptoms, that it's important to contact someone who's an expert in this problem, because they'll be able to recognize it and treat it effectively. So is gastric bypass still the gold standard today? Well, there are many people who would argue that the sleeve gastrectomy procedure deserves equal billing, although the data is not quite as mature. And there's yet others who would say that the lap band has emerged and deserves equal billing as well. Each of the procedures has its own pros and cons. I think that the gastric bypass operation has many very favorable qualities. I have performed around 2,000 of these procedures over the years, and the overwhelming majority of people are very successful in losing weight and keeping it off. The data about keeping the weight off over the years shows that anywhere between 10 and 30% of people do regain weight years later after weight loss surgery, regardless of the type of operation performed. So it does speak to the fact that none of these procedures is a magic wand, and that it is very important to maintain an effort to keep the weight at a healthy weight over the long term. It does require hard work and effort, and these tools of weight loss surgery are very effective, but they don't work alone. So will it maintain its position as the gold standard? I think it will be around for a long time to come. I think it's such an effective intervention that we will see laparoscopic gastric bypass surgery being done for many years to come. And if that's what you choose to do, I hope that you're very successful with it.